Well, the issue with intensified alkylating chemotherapy with autologous stem cell rescue is that, in fact, it has become a taboo in the United States, especially. And this is because, well, in fact, the first study on this treatment was published by Bill Peters back in the 80s. And in fact, he showed that with this regimen, patients, similar patients, stage 3 patients, could achieve similar survival as we in fact saw in SUBITO. But he accrued really young patients, so probably many patients had a germline BRCA mutation on that study, and that's why he saw these favorable outcomes. But then a physician thought, well, we can use this regimen to cure all high-risk breast cancer patients. And so they started randomized clinical trials and accrued all high-risk breast cancer patients. And then they did not see any difference between the two arms, so the standard chemo and the high dose, which makes sense because the large majority of patients does not have a triple negative HRD tumor. So I think that's one of the reasons why high-dose chemo has been abandoned completely. And afterwards there was, one of the studies, well, in fact, most studies showed no difference between the two arms, but there was one study who showed an impressive effect of high-dose chemo. And then it appeared that this person had committed fraud. It's called the Beswoda case. And so therefore, I think it's almost nobody dares to talk anymore about high dose. And so this trial is a bit against the common belief. Yet I do think so that for some patients it could be a useful option because it's so short, especially for those patients who tolerate it well. Well, I think in the world nobody will reintroduce it, although it's readily available next door with the hematology department, because hematologists use it all the time. Maybe in the Netherlands we will see whether it will be available. Our Dutch Health Council is now judging the data, and well, the jury's still out. We will hear maybe in half a year from now whether it will become available for this 1% of patients.